Once again, hi everyone. Thank you so much for being here and for attending today's webinar. My name is Amir Ali. I'm the founder of Youth STEM Initiative, and I'm pleased to present to you our speaker today, Dr. Taieb Ash, a medical doctor and researcher specializing in diabetology, obesity, and reproductive endocrinology, who's also involved in a lot of work with improving women's health in Tunisia. I'll now carry it on to our outreach director, Maya, to give a more complete introduction to Dr. Ash. Maya, are you there?
You hear
Yeah.
me?
Yes, we can hear you. Go ahead.
Okay. So, Dr. Ash is a prominent advocate for women's health and fertility in Tunisia, constantly conducting free workshops to prevent infertility. In addition to his advocacy work, he serves as a tutor and professor and is also a member of the Society of Endocrinology. Dr. Ash has authored over 60 publications, including the award-winning paper Cortisol Cut Points for the Glucagon Stimulation Test in the evaluation of the hypothalamic uh, pituitary adrenal axis, which earned him the 21st Sanofi Prize in Health Practices Research. Through his diverse roles, Dr. Ash plays a crucial role in advancing healthcare in Tunisia and internationally. So with that said, we're gonna have just a quick how we're gonna organize our webinar. So the webinar content. So first, as we just finished the small intro of our guest speaker, and now Dr. Ash's presentation, and at the end we'll have a small Q&A. So Dr. Ash, the floor is yours.
All right. So, Dr. Ash, once again, thank you so much for taking some time out of your busy schedule to speak with us. Firstly, can you tell us more about yourself, your scientific background, and how you ended up becoming such a great advocate for women's health in your country?
So, hi everyone. Thank you for having me. Thank you, Amirali, and thank you, Maya, for the introduction. It was great, and especially with the difficult words of endocrinology, hypothalamic axis. Every word in endocrinology is a little bit difficult. I understand. So thank you for having me. So to present myself, Dr. Taieb Ash, as you said, I'm a physician and a specialist in endocrinology and diabetology. And my special field is the reproductive endocrinology. It's the specialty working on hormonal on glands, what we call gonadal glands that serve for fertility and the for puberty also. So I'm also a professor at the Faculty of Medicine in Sousse. I work in Tunisia actually currently. And as you said, I work mainly in this field in reproductive health. I work with other specialties, and we search clinical practices, research, education to improve healthcare outcomes about hormonal field, especially in women. So my role, my primary focus has been on raising awareness and improving the management of hormonal and metabolic disorders. When we talk about endocrinology and diabetology, we talk about metabolic diseases. The metabolism, to summarize, metabolism is the work on systems that provide energy in our body. And my researchers also work on polycystic ovary syndrome, a very complex condition that is often associated with metabolic disorders like type 2 diabetes, obesity, and other problems, health problems like this. So
Awesome.
this is the global introduction.
Yeah, that's a lot. It's brilliant.
Thank you.
So I know you already gave an introduction, but can you tell us a bit more about what your research looks into and its broader implications, as well as what your advocacy for women's health in Tunisia entails?
So my main researches in the last few years was focused on polycystic ovary syndrome. As I've said before, it's a very complex disease. The main cause of infertility in women nowadays, affecting approximately 10%, 10 to 20% of young women. And it's the main cause of infertility in fertile women. So we work in a multidisciplinary approach, helping address both hormonal and metabolic consequences of this condition. And we try to raise alarm about the complexity of this disorder, and to how we say to make the management of this disorder more standardized and more efficient than it was in the last few years. So I try to promote women's health on this side, and by working on the metabolic aspects like obesity, and also on the hyperandrogenic side of this condition, because PCOS, I don't know if you know a little bit about this condition, but globally, most of the patients that consult for PCOS are consulting for skin disorders like hirsutism. Hirsutism is the excess hair growth, and also for acne, for example. As we showed in the last papers that we published in several journals, we found that 65% of women that consult for a normal, or how we say, just for a symptom of acne, it was linked to PCOS. And we all know that treating acne in PCOS is not the same it's not the same way that treating acne in a normal condition. So that's our main research works. We try to raise more attention about this condition, and try to how we say give courses and how we say preventing the complications of this disorder.
That's incredible. Okay. Well, that's a lot. Thank you for defining some of those terms for those of us who don't know. Now,
Thank you.
my next question is, what do you think is the number one challenge that women in Tunisia and around the world really face when it comes to their reproductive health? And to what extent has your research and advocacy helped with that?
So thank you for this question. I've worked in other countries before working this field in Tunisia, and as you might know, that the health system in Tunisia is not as much improved, and we don't have the same tools and means in other European or the American country, or in other neighbors countries. So one of my key goals is to improve healthcare outcomes in Tunisia. So particularly in the field of reproductive endocrinology, but also the metabolic disorders, and especially obesity. So we try to make significant progress among other specialties like cardiologists, gynecologists, and other specialties that are implicated in this field. So we improved our diagnosis methods and our explorations to make more economies in these aspects. But there are still gaps in awareness and access to specialized care for conditions like PCOS and other hormonal imbalances. So in Tunisia, many individuals still face challenges in receiving early diagnosis and comprehensive treatment for these conditions, especially because it implicates a lot of specialists. So, as for example, for acne, the patient, or for menstrual disorder, the patient can consult for this symptom a gynecologist or an endocrinologist, or even the first care practitioner. So all these specialists will have a different approach of this symptom. So we advocate for a better screening, increasing knowledge about hormonal disorders, and we try to enhance the availability of advanced treatments, even if our means in Tunisia are not the same in like in other countries. So we can improve both quality of life and long-term health outcomes for patients across across the country, across Tunisia.
Okay,
Thank you so much.
Thank you so much for that.
Thank you. I think
yeah,
it's okay. You can hear me?
Yeah, we can hear you. Yeah. So this brings me to my next question, which is, I mean, of course, you're having a tremendous impact on women's health in Tunisia, but I'm wondering if you've also done work in other parts of the world to help with fertility and reproductive issues in other countries as well.
Yes, in fact, I have the privilege of working with other teams in other European countries, mainly with French teams. I've worked with the past few years. I think research is the most important aspect in my professional journey, and I consider it a privilege to contribute to the scientific community with our local understanding of reproductive endocrinology, especially within the context of Tunisia. So we try to conduct research with other teams, French teams, Algerian and Moroccan teams, which allow to explore novel diagnosis approaches, improve diagnostic methods, and to understand the impact of other environmental factors such as the endocrine disruptors and other things that could affect hormonal diseases. Hi, VM, I can hear you.
Yeah, if you could mute.
I think thank you, Ian. So I think it's incredibly how can I say rewarding to be part of a global network of researchers who are working together to address the growing burden of metabolic disorders and infertility. As for example, the obesity currently obesity is the #1 disease in the world, with 1 billion people affected, and in Tunisia the prevalence is also very high. We've reached 30% of the adult population affected with obesity. So research not only advances our understanding, but also directly informs the care we provide to patients, allowing us to develop what we call evidence-based strategies that improve health outcomes in Tunisia and in other countries. So in Tunisia, the potential for growth in this area is important is immense, and I'm excited to continue contributing to it.
Sweet, that's very inspiring.
Thank you.
So a lot of us probably, especially the younger ones, like myself, I think we sometimes aren't able to manage our time very well. So for you, as such a busy doctor and advocate, how do you balance both your research work and the work that you do as an advocate? And is there one that you like doing more and that you find more impactful?
So I think when we see our students, I think all students are took by time with an overload of courses and informations. I do understand that. I think becoming a researcher requires mainly combination of curiosity. I think importantly, dedication and mainly perseverance. Because, for example, when you try to make a study or research for something, most of the times you will be frustrated with some results that are not you're not waiting for them. So you have to be dedicated and to persevere in these this field. So it starts with a solid foundation in medical sciences, followed by commitment to continuous learning and curiosity, passion for asking questions. In Tunisia, I have the incredible luck to work with other researchers, other friends and doctors that work in the same field with me. They are that enrich my experience, and I do have a lot of very good students that are very dedicated in research and improving healthcare in Tunisia. So for those interested in pursuing research as in their career, I recommend immersing themselves in both clinical practice and academic studies, and to try to collaborate. I think collaboration is key. Working with experienced mentors, joining research teams, and attending international courses, conferences are all essential steps for young doctors to become involved in research. So it's important to stay curious, seek out mentorship, and embrace the challenges that come with conducting research, knowing that ultimately this will lead to advancement that can benefit patient and society as a whole, I think. That's my personal idea of research, and that's it. That's my advice for young students and researchers.
Fantastic. I know I'll be noting that that advice for sure. So thank you for sharing that. Now we have our Q&A period. So the rest of you, if you have any questions, please feel free to ask now. You can just jump in, don't need to raise your hand. So yeah, go ahead if you have any questions. You can ask in the chat too if you want.
Yes, so my question for you, Dr. Ash, is how did you find out about your passion for endocrinology and women's health, I guess, advocacy?
Thank you, Maya, for your interesting question. So in my personal experience, my passion for health and human body began very early with a particular love for sports, for the healthy nutrition during my childhood. I was fascinated with what we call physical performance and well-being, deeply influenced. That deeply influenced my choice to pursue endocrinology. Endocrinology is a very complex field that works on hormones. When we talk about hormones, we talk about several substances that are integrated between themselves with stimulation, inhibition, various circadian rhythms, biological rhythms that are not stable. That's the main my main fascination starts with the physical performance and nutritional health. So I dedicate my career in advancing women's health in this aspect, knowing that gonadal hormonal aspects in women are more fascinating than male hormonal aspects. When we talk about hormones in women, we talk about, for example, the menstrual cycles that are not stable, that are fluctuating for several days. And as for example in male, that the gonadal rhythms are more stable. So this fascination increased with the years of medical studies, and I think I have made the good choice, because I like to think, I like to understand things that are sometimes complex. And it's a good specialty. It's a good specialty if you like nutrition, if you like metabolic aspects, if you like to talk with the patients. We talk a lot with patients with about the therapeutic education, how we manage chronic diseases, and how we manage the environment, nutrition. As I said before, these endocrine disruptors like plastic exposure, the pollution. We talk about all these aspects in our specialty. So that's it.
Brilliant.
Thank you so much for your response.
Thank you.
Thank you, Maya, for the question. Any other questions?
Yes, hello.
We can hear you.
Hi.
I would like to ask, what are the other specialties that you work with in terms of PCOS?
Thank you for your question. I've worked with, currently we work a lot with other specialists that work in the hormonal aspects of PCOS and obesity, mainly gynecologists, dermatologists. We work also with psychiatrists, because these diseases often lead to several psychiatric affections and complications, mainly with depression, anxiety. So when we talk about promoting health in Tunisia and worldwide, we cannot work alone. It's important to raise, because we talk a lot nowadays about bridging specialties. We're not working alone. We try to make the whole care for these aspects standardized among every specialist that is concerned with these diseases. So we try to focus on women's health directly and contribute to prevent these complications. So especially gynecologists, dermatologists, and psychiatrists.
Thank you for your answer.
Thank you.
Hello, everyone.
Hi.
Hello. At first, I want to send my special thanks to Dr. Taieb.
Thank you.
And in fact, thank you. In fact, I have personal questions. I know that you are brilliant and clever, and you can find more opportunities and best opportunities abroad. But you want to you stay here in Tunisia, and you choose the public sector. So I want to know, where did you take the the patients, what did you take from the patients to stay here in these hard conditions?
Thank you, Hussein. Thank you for your great question. It made me smile. So, first of all, I'm deeply in love with Tunisia. So even when I traveled a lot and worked with other teams and worked in other countries, I felt that my how we say my personal journey in science would be in my country, in my Tunisia, even if the means and we don't have enough funding in several research areas, but we try our best to improve these aspects. And I don't know if you're in the medical field, but I would like to say that doctors in Tunisia are among the best in the world, and we do have several arguments about that. And if you search in each great team that made famous researchers, you will find the Tunisian. You will find the Tunisian doctor. So my main goal was to improve healthcare in Tunisia. In my field, the fertility, obesity, as I said, and we have a lot. We have many individuals in Tunisia facing these challenges, and we have to improve the healthcare system and bridge these gaps by researchers and education for our students, for other specialists. So we try to advocate, as I said, for better knowledge, enhance the availability of diagnosis, to simplify the diagnosis of these aspects, and mainly to improve quality of life and long-term health outcomes. And Tunisia is a very beautiful country. So I think I'm good. I'm good here. I do what I love, and that's it. The research environment here is very good. We do lack of several, especially funding, but otherwise, our students are incredible. My other specialists, my friends specialists are also incredible. We do great works. We do great works, and we're happy. We're good. And I advocate for staying in Tunisia.
Thank you. Good job.
Thank you, Hussein.
Okay, I think we might have time for one more question. If anyone wants to ask a last minute question.
Questions were good, especially the question about Tunisia.
Yeah.
So I have just one last question. So, what tips would you give for research for people that like want to start it at a young age? Like any tips?
As I said before, Maya, my most important tips is would be curiosity. Remain always curious. Try to search. Try to read. Try to improve our understanding of these conditions. As I said, obesity is a very prevalent disease, the #1 disease in the world. So we have to work on this field and to improve our knowledge and try to make the other people, because obese people generally do not consult for their condition. So we have to raise awareness about this condition in its early stages. So also curiosity and I think perseverance, because if you don't persevere in researches, you will be frustrated, and several researchers will stop their career very early and will turn in the clinical fields. it's good. It's good. I think working in the clinical aspects is always good, but research is very how we say gratitude when you found good results, and when you improve the healthcare aspects with your research. It's very how we say, the gratitude is very important with that. I don't know if you understand me. Some words will I don't find some words in French very easier. So I think it's very important to remain curious and to seek out mentorship, because when you have good mentors, you will find it will be more easier for students and for young researchers to embrace challenges and to conduct structured researches. That's it. Curiosity is the key.
Thank you.
Thank you, Maya.
Hello everyone. First, I'd like to thank Dr. Taieb for his time and dedication.
Thank you.
I would like to repeat Nesma's question, because I think that you didn't read that one. So her question was, are you working or on any what are you working on right now? Is there any special topic, or is there any research that you're conducting at the moment?
Thank you, Shuruf, for your question. Shuruf actually is my student, one of my brilliant students. So I know she's following our researchers very well. So thank you for your question. Currently, we are working especially on PCOS, as I said, the long-term complications, the hormonal aspects, the metabolic consequences, mainly type 2 diabetes. And we will focus in the next, I think the next year, we'll focus more on the dangerous effects of endocrine disruptors in our environment. I don't know if the audience know about endocrine disruptors. These are the small substances that influence on our hormonal glands. So these substances exist in our environment, and their role is in worsening public health concerns, particularly in the area of fertility and obesity, is very important. So we try to raise awareness about these aspects, and these will be our future studies, I think, to work on these aspects. And we'll continue to work on infertility linked to metabolic disorders, as like obesity, the role of some treatment like metformin. Metformin is the treatment that help insulin to work in obese patients. So we have several works. We try to publish them in famous journals to remain to spread the knowledge in other countries, and we publish them in some social medias, especially in LinkedIn. So that's it. So it will be about obesity and endocrine disruptors and PCOS.
I know that you like metformin a lot. Thank you. This is really interesting.
Endocrinologists like metformin.
Yeah, I bet. Thank you so much.
Thank you, Shuruf. Thank you.
Awesome.
Not if you can hear me.
Yes. Any other questions? If not, I do have one last question. So a lot of us, or a lot of professionals who do research like you, do have to deal with certain I guess setbacks And how do you handle those setbacks? Do you have to redo the research or maybe do it in a different way? What are some strategies?
I think we do a lot of researches and we conduct a lot of studies, and I think the in my early career, several of them were did not succeed. So when you start your early career, most of the times it will not succeed because of technical problems, because of we conduct the study with some patients and they leave the study. They have other problems that might occur, like acute diseases. So we deal with a lot of technical, medical, especially funding problems. So we try to do with it. We spend a lot of money. We do lose a lot of funding in these aspects, but we have to persevere. We have to we keep our dedication in this field. We try to seek the experience of our mentors, of our friends, and we try to involve students in this field, even if it's a very, very difficult field. Research needs a lot of hard work and patience. So we try to warn young researchers about these aspects. It will not be easy, but when it succeeds, it's very incredibly good. We're very happy at the end.
Definitely. Thank you for that advice. So, any last minute questions? Once again, you can just jump in or ask in the chat. If not, we could end it. Yeah, it's always great to receive guidance and
Thank you.
from professionals like you. So
Thank you, Amir. Thank you. Thank you for the audience. Thank you for your great questions.
Of course,
It was very good.
Thank you so much for speaking at our webinar today, Dr. Ash. And keep up the great work that you're doing to make a positive difference in the lives of women in Tunisia.
Thank you.
And whether you're in Sousse or any other part of the world, we have no doubt that you're making science and women's health better and better every day. I personally hope I see you in person one day, rather than just
I invite everyone in the chat, and especially you. I think Maya is in Tunisia, so Maya will advise you to come in Tunisia and for vacation, or for if you want to make a stage or courses in research or in endocrinology. You're welcome. Everyone is welcome.
Yeah, I've never
We
been
eat
to
well.
Tunisia, but I would love to come. It's definitely on my list, and now I have another reason to go. So yeah, and who knows, maybe one day we can be working together in a research lab or on.
I'd hope to. I'd hope to.
Yeah.
Thank you.
Yeah, thank you so much. We appreciate you.
Thank you. Thank you very much. See you soon.
Of course. Take care.
Thank
Bye.
you.
Have a great day.
Salut.
See you, everyone.
Salut.
Bye.